Hi everyone, my name is Taylor Scott and I am completing my evaluation project on the school and mental health services that are provided by Fernbrook Family Center, and I hope you enjoy. So for the assessment and problem identification, we are assessing the mental health in children and adolescents. It's something that is currently happening and it's on the rise and it's not going away anytime soon. It is Mental health in children is something that is becoming a really big problem. And even the service delivery is also a problem as well. So what is school-linked mental health? School-linked mental health is a intervention that is provided to students within their school day. So for example, they can go see a therapist at their school during one of their class periods if need be. So Fernbrook Family Center is where I'm completing my placement, and they are contracted through many schools through various counties to provide these school-linked mental health services. They have therapists within various schools that are providing therapy to these students during the school day. So the hypothesis was if students are receiving school-linked mental health services within their school day, then do they have less absences? So this is what we will be assessing right now. I was working with a group at Fernbrook Family Center of staff members. So we were just looking at student absences, and then the hope was in the future that they could look at academic achievement, such as their grades, and even their overall mental health as well. So for the planned intervention, school-linked mental health services is the intervention, and schools are increasingly providing therapy to students. There are a lot of articles discussing how likely it was to have these services within the school rather than just having a counselor or a social worker. They have a counselor, a social worker, and a therapist, and they are providing these more intense mental health services. So why it's important? As I discussed before, mental health issues in youth is something that is happening all over. It's not just centralized, it's not decreasing at a rapid pace. It is something that is increasing and needs to be assessed. And it can also help increase the amount of school days missed. So youth may be having issues with their mental health and they may not want to come to school. So providing this therapy in school provides them a go-to person if they were to need somebody. Also, students are missing school to leave for these therapy appointments, therefore decreasing their academic success and increasing the amount of school days missed. So providing these school-linked mental health services within their school day helps them miss less school, and it helps them miss shorter amount of class periods. So here is my logic model. So the inputs would be therapist, funding, grants, and an office for staff. So Fernbrook Family Center is a for-profit organization. So they do something called the MIN grant, which is through Minnesota, and they provide funding and grants for certain students to receive these school-linked mental health services. Outputs would be hiring and training staff, providing different types of therapy such as CBT, DBT, motivational interviewing, and strength-based. The therapy type chosen will be based on the student's needs. Interventions provided to help the student be successful at school. Interventions provided to help the student be successful within their mental health. Participation would be weekly sessions with students or as needed. So I know some insurance companies only allow students to be seen, every other week, once a week or for an hour. So it depends on the school's on the student's insurance. Weekly sessions will include skills the student is needing to be successful at school while dealing with their mental health issues. So providing them with necessary coping skills or any other interventions that could help them be successful. The outcomes. The short would be students having more confidence coming to school, students feel like they have a safe place to go during the school day, and students will not miss an excessive amount of one class due to having to leave for those appointments. Medium would be students' attendance will improve, students' grades will improve because they're attending more school, and students will not have to leave school for appointments. The long term would be students' overall mental health will improve, more school-linked mental health services will be provided to more communities, students' attendance in future schooling will be improved, students' grades will improve in future schooling, and more students will take advantage of the program. So some assumptions are that teachers are willing to allow students to leave class to go to a session. The nice thing about this is the flexibility. They don't have to schedule it at the same time every week. That way they're not missing the same class period every time. Students will take advantage of services being in school, and that many students need these services. So some external factors include that the parents are willing to have their children leave class and participate in these services. There are enough therapists to provide services to schools. Schools are willing to take in these services from outside providers, and students' attendance may be from bullying in school and out of school. So for the measurement plan, it was measured we measured the amount of missed periods during 2 school years rather than doing missed school days. When we were given the data, it was stated why the student missed a certain class period or why they missed a certain day. So that helped us break down what we would count. So the considerations of a missed period were missed for what was considered an other appointment. So that did not count as a dentist or a doctor's appointment, to go to the school counselor or to go to the school social worker. And prior to these services being provided within this school, they could go see the counselor, and then after these services were implemented, it could count as seeing their Fernbrook worker as well. A bar graph as well as a t-test were used. This was a pretty reliable measurement and evaluation because we were having the attendance records being collected by the secretaries at the school. So the information went straight from the school database to our hands. So we collected the attendance records from secretaries from the 2017-2018 school year and 2018-2019, and again, we received them straight from the schools. So we had some struggles with measuring with meeting with schools due to snow days. Here in Minnesota, we had a polar vortex, so it was really, really cold, and I think we had a snow day for probably a month and a half, at least one a week. So that kind of made it really difficult due to canceled appointments to collect more data from schools. Evaluation, design, and rationale. We used non-probability sampling. Each student was chosen for a specific reason. We didn't randomly choose. We chose all of the students that are receiving Fernbrook services. We didn't leave any out. We just included them all. So it was an extended pre-test, post-test. We assessed the attendance before services and after services. We did use an effect size. And then any potential threats to internal validity were the possibility due to students being gone for treatment, illness, or family events such as a funeral or death in the family. That is why we did take those out and only calculated them due to the appointments or due to the reasons that were discussed in the last couple of slides. We did not measure all of the missed days for this reason. So the data analysis, we only collected from one school currently due to the complications that I had discussed before. We collected information on missed periods, excused and unexcused. So whether they had an excused reason or they had an unexcused reason, we still collected on that missed period. For findings, again, I wish I would have had more data because it is kind of difficult to interpret, but 5 out of the 11 students had a decrease in missed periods, 5 out of 11 students had an increase in missed periods, and 1 student did not decrease or increase because they didn't have any missed periods that worked with our data or with our reasonings. So again, interpretation was difficult due to the lack of data, but next slide I will show you the graph and then as well as the t-test. So here's the graph. You can see we had, again, the 5 students that decreased. So the blue is the 2017-2018, and then the orange is the 2018-2019 school year. So student 1, 3, 4, 6, and 10 all had a decrease. And I would say from interpreting this data, it was a pretty significant decrease. Whereas students 2 and 5, 7, 8, and 11 all had an increase, with numbers 5 and number 7 being a severe increase because of they didn't have any missed periods during the first school year compared to this school year. So again, interpreting it is kind of hard to tell, but it was split pretty evenly both ways. So as far as testing, this is the t-test. The mean for the variable 1, which was 2017-2018, was 7.27, and variable 2, which was 2018-2019 school year, was 5.63. Again, they had the same amount of observations, so 11. And then our effect size was 0.393, which is considered a small effect size. So conclusions, implementation, and lesson. It was difficult to come to a conclusion due to the lack of data. Um, Fernbrook is looking to assess more schools. Unfortunately for my project, I just didn't have the same amount of time as they do to continue on their evaluation. The hope is that there would be more schools as well as more students to decide if the intervention is effective, because it is guiding the program decision. So they are trying to decide if they should implement this in more schools, if they should contract with more schools, if they should start to decrease because it isn't being effective, or what changes need to happen if it's not being effective for these students. So next time I would begin meeting with schools sooner and have a backup plan if things did not go as planned. Again, weather was something that we couldn't control, but it was also kind of a struggle to work with the team that I was working with. They had a lot of things that they had to do to double check on confidentiality and secretaries getting back to them. So I was kind of put in the middle and kind of a middleman, or the schools were also a middleman, so it kind of made it difficult when working with the team as a whole. So again, I really hope you enjoyed this presentation, and I hope you learned something. I wish I had more data for you to tell. As you could see before, it was pretty split pretty evenly, and I'm excited to see how Fernbrook continues this evaluation. Thanks so much.